Ebola, it seems to be all that anybody is talking about these days, but are you concerned that an outbreak might reach South Florida? Should you be concerned? Here is board-certified Florida physician Dr. Sanjay Jain with what you need to know. Dr. Jain, it's great to have you on the show. Welcome.
Thank you.
Welcome aboard.
Appreciate it. Love to be here.
Obviously, Ebola is a topic that everybody's talking about all the time, and people are scared, and maybe rightly so, but maybe over-scared. So let's uncover as much as we can, and let's start with this. On their day-to-day living, how nervous, scared, apprehensive, cautious should South Floridians be regarding Ebola?
Right now, I think they should just be cautious. They don't have to be scared. I think there's still time for this to be eradicated, but we should always be on guard, especially the hospitals, because as a common citizen, you really don't have control over that, but the hospital workers should be trained in how to handle someone walking through the ER door with possible Ebola. So really, the people who should be concerned and should be more on top of this are the healthcare workers.
And with regards to what happened in Dallas, I know the CDC has been concerned, rightly so, that the hospitals didn't have appropriate protocols. So where do you think we are now regarding any hospital in South Florida? If somebody walked in, do you think the staff is appropriately trained?
There's a lot of debate going on right now, and the buzzword is that everybody's okay, everything's fine. That's the dialogue that's being said. But in my opinion, I think we have a long way to go to get our healthcare systems in South Florida and anywhere else in the country up to par with some of those four big hospitals out there, the Emory, the Dallas, there's one in Nebraska, these super centers that take care of it. So we have a long way to go. At this point, I think the healthcare workers, the air doctors are being trained to manage it, are being sent emails. I get emails all the time, faxes, and how to manage this crisis. And so really there's a lot of training that needs to be done.
Ebola's been around a long time. It's not like this is a brand new disease that just came around, maybe like swine flu or something like that. But did hospitals talk about this at all over the past couple of years? Doctors trained about this at all?
This is something new. This is a new phenomenon because we thought it was on the other side of the ocean. It's not here. We don't have to worry about it. So what's happened now, it's actually come in our own land, on our own continent. And rightfully so, people should be concerned. And so what's happened is that now the military's out there, they're trying to build facilities. But what happened was before, in the past, it was pretty much contained, but it broke containment. It went 1,000 miles to other countries, whereas it was only in a few villages. So now that it's broken containment, that's where things kind of went out of control. And right now it's raging like wildfire out in West Africa, and we really got to be on top of this. And the problem is that who's in charge? Is the CDC in charge? Is the White House in charge? The military is involved. So we really got to get the coordinated effort in figuring this out.
All right, so from a medical standpoint, I realize this might be more of a political issue than a medical issue. Medical standpoint, where do you come in with regards to not flying to West Africa, not having flights from West Africa back to here, essentially quarantining them, if you will, keeping them away from the United States? What do you think?
In my opinion, I am not opposed to that at all. There's various opinions. They're saying the claim is if we stop travel, they're not going to get their supplies, they're not going to healthcare. But then why not just have a one-way flight? We don't have to have commercial passengers coming here. Why don't we just send cargo flights there with supplies? And if we have to send healthcare workers, it's just fine. But just don't have a one-way ticket, and then we can actually have military transport and kind of triage what we're sending in healthcare workers to bring them back. But I'm not so sure about commercial passengers.
So if you go that route and a healthcare worker wants to come back, what do? You leave them there for 21 days?
You don't leave them for 21 days. I would say you kind of bring them back through our military that's there, or even kind of put them through a sanitation wave, kind of filtering and kind of going through the fever checkup and making sure that they're not contaminated. So you have to go through a process of screening before they get here.
Let's talk about air travel and specifically symptoms. Because from what I understand of Ebola, it's pretty hard to catch in regular communication. But people are flying, not necessarily just to Africa, but maybe anywhere really. What do people need to know about?
So number one, it is not airborne.
Okay.
So you're not going to get it from someone's coughing, or it's not going to be floating around in an airplane. Number two, you can only get it if that person is symptomatic. So if the patient or the person who has Ebola is not symptomatic, they are not contagious. So there's a big difference. Now, what does it mean by being symptomatic? You have to have fever, so that's symptomatic. If you're having chills, body aches, you're getting diarrhea, nausea, that's symptoms. So when they're in the active symptom phase, then they're contagious. Then you don't want to touch them. Even body contact fluids, that's where you got to be careful of.
Right.
Now, in an airplane, you don't want to touch anything, but you just have to be cautious.
And I know, just again, for me looking at the symptoms, I know it can be transmitted via sweat. And to me, that was the one that sort of scared me. Like, it's hard to get someone's blood on you, and it's hard to maybe get a sneeze in your face. But I don't know, maybe somebody's perspiring and they sort of rub up against you. That was the one that, to me, kind of scared me a little.
And rightfully so, because we've just had this patient, this nurse in Dallas who had all this protective gear, and for some reason she got Ebola from some kind of contact, whether it's from her glove or whatnot. We don't know that right now. But yeah, if a person is symptomatic, you can get it from sweat. That's bodily fluid.
Sure, yeah. So where do we go from here? Do people need to be more vigilant with regards to their children, for example? And I know, again, we've only had, now 2 documented cases in the United States, the guy who came over and then the nurse at this point. So people shouldn't freak out, but parents sending their kids to school, do anything differently?
You know, you're going to send them to school. You got to teach your kids, educate your kids. Washing your hands and just being more mindful, just because we're going to also deal with the flu.
Right.
And so we're also going to be confused about, is this the flu or is this Ebola? And so, teaching your kids about sanitation, washing your hands frequently, what you touch, and basic sanitation education would be very helpful. And the school itself should be educated, not just the kids, but the teachers, the principal, the people who are in that environment. If they see someone who's sick, maybe have a different threshold of sending the child home so they're not affecting anybody else. And also knowing your community. And so knowing what community, like in Washington, D.C., there's a big West African community. So you have to know your community. Some communities just don't have to worry about it as much. So also knowing your environment would help.
And the last question, treatment of it, if somebody has it. How effective is it? It seems that lives can be saved if you catch it early enough. Where do you think we are with treatment?
We have a long way to go. We have these experimental drugs out there. Some of them work, some of them don't work. The best thing is to catch it as early as possible. A gentleman who died in Dallas, it was too late. So getting it as early as possible is the best thing.
I saw an interview with the lady whom he was a guest at her home, and she still, as of a couple of days ago, had his sheets and his towel in the apartment in a plastic bag.
When I heard that, I was shocked because they kept this family in the same apartment with all this stuff lying around.
Yeah, well, I don't get it.
I don't get it either.
Yeah.
And what I found out was that they had a hard time finding contractors to want to go in there, the hazmat people that want to clean it up. So there's a lot of bureaucracy with it. They had to get a license to go in there. Then they try to find the contractor who was willing enough to go in there and sanitize the place, so they couldn't find anybody. So that's what the delay was.
So basically, it's her problem. It's the lady who leases the apartment. It's her problem.
Yeah, and so people, it's like, you know what? And the concern now is this lady, this nurse in Dallas, who just got the Ebola, taking care of this patient. Now people, nurses and doctors, are like, oh my gosh, why am I going to treat an Ebola patient if I'm going to get affected? So that's another problem. People might be scared to get involved in the healthcare.
Thank you, Dr. Jain, and if you want more info from the doc, just go to his website, sanjayjainmd.com. When we come back, the 5 business rules you should break. That's next.